Good morning, good afternoon, good night. Welcome to my channel, where we share scientific material with Creative Commons license on various topics related to health in general. I hope you and your family are in very good health. Today I want to share with you a study published in 2021, in the journal Molecules, that has the following title: The Mechanism of Honey in Reversing Metabolic Syndrome. Greetings and thanks to the authors Kairanisa Hashim, Kokyong Chin, and Firas Ahmad. The reference to the study can be found below in the video description. First of all, I want to clarify that the content provided on this YouTube channel is for educational and informational purposes only. It should not be considered medical or professional advice. If you have any concerns or questions about your health, we recommend that you consult a doctor or qualified health professional. Let's get started. Abstract of published work. Metabolic syndrome is a constellation of risk factors comprising central obesity, hyperglycaemia, dyslipidaemia, and hypertension, which predispose a person to cardiometabolic diseases. Many studies reported the beneficial effects of honey in reversing metabolic syndrome through its antiobesity, hypoglycaemic, hypolipidaemic, and hypotensive actions. This review aims to provide an overview of the mechanism of honey in reversing metabolic syndrome. The therapeutic effects of honey largely depend on the antioxidant and anti-inflammatory properties of its polyphenol and flavonoid contents. Polyphenol, such as caffeic acid, Ca, p-coumaric acid, PCA, and gallic acid, Ga, are some of the phenolic acids known to have anti-obesity and anti-hyperlipidemic properties. They could inhibit the gene expression of sterol regulatory element binding transcription factor 1, SREB1, and its target lipogenic enzyme, fatty acid synthase, FAS. Meanwhile, caffeic acid and quercetin in honey are also known to reduce body weight and fat mass. In addition, fructooligosaccharides, FOS, in honey are also known to alter lipid metabolism by reducing fatty acid synthase activity. The fructose and phenolic acids might contribute to the hypoglycemic properties of honey through the phosphatidylinositol 3 kinase/protein kinase B insulin signaling pathway. Honey can increase the expression of ACT and decrease the expression of nuclear factor kappa B, NF-kappa B. Quercetin, a component of honey, can improve vasodilation by enhancing nitric oxide production via endothelial nitric oxide synthase and stimulate calcium-activated potassium channels. In conclusion, honey can be used as a functional food or adjuvant therapy to prevent and manage metabolic syndrome. Introduction. Metabolic syndrome is a constellation of risk factors that predispose an individual to type 2 diabetes and cardiovascular disease. About 25% of the world population is affected by this condition. There are multiple definitions or diagnostic criteria formulated by different organizations at a global level. The most recent classification for the diagnosis of metabolic syndrome, known as the Joint Interim Statement, JIS, was proposed to unify the previous criteria. The JIS criteria for the clinical diagnosis of metabolic syndrome include: elevated fasting blood glucose, FBG, greater than or equal to 7.0 millimoles per liter, or drug treatment for elevated glucose. Elevated blood pressure, systolic blood pressure, SBP, greater than or equal to 130 mm of mercury, and or diastolic blood pressure, DBP, greater than or equal to 85 mm of mercury, or drug treatment for hypertension. Elevated serum triglyceride, TG, greater than or equal to 1.7 millimoles per liter, or drug treatment for elevated TG. Reduced high-density lipoprotein, HDLC, 1 millimole per liter in male and 1.3 millimoles per liter in female, or drug treatment for reduced HDLC. Elevated waist circumference, WC, according to population and country-specific definitions. Lifestyle changes continue to be the primary approach in treating metabolic syndrome, while drug therapy focuses on treating each metabolic syndrome component. Often, Patients present multiple conditions and require multiple drugs, resulting in polypharmacy. In recent years, various studies have demonstrated the use of natural ingredients, such as cinnamon, ginger, and other plant-derived therapeutics, as a dietary intervention in preventing or treating metabolic syndrome. Some of the apitherapy agents intensively investigated include honey, propolis, pollen, bee venom, and royal jelly. Honey is speculated to be a potent metabolic syndrome preventive agent due to its antioxidant, anti-inflammatory, hepatoprotective, antihypertensive, and anti-obesity properties. The mechanisms of honey in reversing metabolic changes. The therapeutic effects of honey largely depend on the antioxidant and anti-inflammatory properties of its polyphenol and flavonoid content. The phenolic acid and flavonoid profiles of honey vary based on factors, such as climate, geographic factors, and floral abundance. A study on the total phenolic contents and color intensity reported a positive correlation between total phenolic content and color intensity of honey. The polyphenol and flavonoids are potent antioxidants because they can donate hydrogen and hydrogen groups to scavenge free radicals in oxidative stress. Polyphenol, such as apigenin, quercetin, and camphorol, may also exert their anti-inflammatory properties by modulation of enzymes involved in pro-inflammatory activities, such as nuclear factor kappa B, NF-kappa B, activator protein 1, AP1, or nuclear factor erythroid 2-related factor 2, NRF2. Anti-obesity properties of honey. Honey was reported to reduce weight gain and body mass index, BMI, in rats with obesity induced by a high-fat diet. Similar results were demonstrated by other investigators. The rats showed reduced body mass index, BMI, percentage body weight gain, adiposity index, and relative liver weight after a 6-week honey supplementation. In addition, human interventional studies also found a similar finding marked by a reduction in body weight, body fat, and lipid profile after consumption of 70 grams of natural unprocessed honey for 30 days. Furthermore, a randomized open-labeled controlled clinical reported a significant reduction in body weight, body mass index, BMI, waist circumference, WC, hip circumference, and lipid profile in obese patients treated with unprocessed and processed honey. The honey was supplemented at 48 grams for 48 days in these patients. Honey is rich in polyphenol known to reduce body weight and fat mass, which explains its anti-obesity properties. Among the most studied are caffeic acid, gallic acid and quercetin. Besides, fructooligosaccharides, FOS, are also known to alter lipid metabolism. FOS in honey are resistant to human digestive enzymes and could act as probiotics. Various studies reported that the administration of these fructans promotes a reduction in weight gain and energy intake. FOS also decreases malic enzyme, ME, activity, a lipogenic key enzyme in providing nicotinamide adenine dinucleotide phosphate, NADPH, for fatty acid elongation by fatty acid synthase, FAS. Therefore, FOS can inhibit the synthesis of long-chain fatty acid. Some researchers showed a reduction in the activity of lipogenic enzymes, such as acetyl-CoA carboxylase, ACC, malic enzyme, ME, and fatty acid synthase, FAS, after FOS supplementation by modifying the gene expression of these enzymes. Antihyperglycemic properties of honey. Honey is a sweet substance with a relatively low glycemic index, making it a suitable sugar substitute. The fructose present in honey contributes to its sweet taste. The major source of fructose used by the food industry as a sweetener is derived from cane sugar or high fructose corn syrup. Fructose is a potent and acute regulator of liver glucose uptake and glycogen synthesis. It forms TG more effectively and is more lipogenic than glucose despite having a similar chemical structure. In the liver, fructose is transported by insulin-independent glucose transporter, GLUT5, and is metabolized to fructose 1-phosphate by the enzyme fructokinase. High fructose intake results in postprandial hypertriglyceridemia and an increase in visceral adipose deposition. On the other hand, honey can normalize circulating glucose levels because its fructose content can prolong gastric emptying and lower food intake. The hypoglycemic properties of honey have been illustrated in rodent models of diabetes, healthy subjects, and diabetic patients. These effects might be contributed by the components of honey, such as fructose, and phenolic acids. Honey could modulate the key components of the insulin signaling pathway, phosphatidylainositol 3 kinase, protein kinase B, PI3K/ACT. The development of insulin resistance is characterized by an increase in nuclear factor kappa B, NF-kappa B, mitogen-activated protein kinase, MAPK, and insulin receptor substrate 1, IRS1, serine phosphorylation. Treatment with honey extract and quercetin reported an increase in the expression of ACT and decreased expression of IRS1 serine phosphorylation, NF-kappa B, and MAPK. Interestingly, long-term honey consumption in the presence of a high-fat diet did not significantly increase the insulin concentration. Honey was reported as the sweetener that increased phosphorylation of IRS tyrosine and protein kinase B, ACT, and lowered the protein abundance of nuclear factor kappa B, NF-kappa B, which indicates better insulin signaling. It was also observed that honey significantly increased white adipose tissue GLUT for expression in rats, an insulin-sensitive glucose transporter that moves glucose into the adipose tissue, indicating better insulin sensitivity. Anti-hyperlipidemic properties of honey. Many studies on the hypolipidaemic effects of honey have been conducted. The natural compounds in honey contribute to its lipid-lowering effects. Polyphenol, such as caffeic acid, Ca, and p-coumaric acid, PCA, commonly seen in all honey possess numerous bioactive properties including antioxidant, anti-inflammatory, and lipid-lowering actions. Studies on caffeic acid, Ca, and p-coumaric acid, PCA, have shown that both compounds can reduce the mRNA expression of sterol regulatory element binding transcription factor 1, SREP1, and fatty acid synthase, FAS, and inhibit their activity. Free fatty acid, FFA, is the main player in the synthesis of triglycerides, TG, in hepatocytes. In metabolic syndrome, lipolysis in adipose tissue increases, resulting in enhanced free fatty acid, FFA, delivery to the liver. Both SREP1 and FAS are key regulators to FFA synthesis, and their dysregulation is the primary source of hypertriglyceridemia. In recent studies, phenolic compounds can activate adenosine monophosphate activated protein kinase, AMPK, which mediates the reduction in SREP1C protein expression by preventing SREP1C nuclear translocation, subsequently suppressing FAS synthase expression. Gallic acid, GA, and catechin can also be found in honey. Some observations indicated that GA and catechin might attenuate hepatic lipid accumulation by regulating fatty acid, FA, and triglycerides, TG, synthesis. The effects of these individual compounds might not fully explain the anti-hyperlipidemic potential of honey, as they might act in synergy with other components to achieve the overall effects. Antihypertensive properties of honey. Flavonoids present in honey, such as quercetin and camphorol, show promising results in the treatment of cardiovascular diseases. Some authors reported that treatment with quercetin for 13 weeks lowered blood pressure and heart rate in spontaneously hypertensive rats. This was achieved by upregulating endothelial nitric oxide synthase, ENOS, and P47 protein expression and reducing nicotinamide adenine dinucleotide phosphate, NADPH, oxidase-mediated superoxide anion generation, which attenuated endothelial dysfunction. Another in vitro study showed that quercetin increased the conductance of calcium-activated potassium channel, BKCA, currents in rat coronary artery rings. Given that BKCA regulates coronary artery tone in vivo, quercetin could induce vasodilatation. In addition, Quercetin also reduced endothelial proliferation by 56% and increased cyclic guanosine monophosphate, CGMP, level by 5-fold due to nitric oxide, NO, formation. Meanwhile, treatment of camphorol is reported to suppress the expression of nuclear factor kappa B, NF-kappa B, by lipopolysaccharides, LPS, significantly. In addition, tumor necrosis factor alpha, TNF-alpha, was increased in lipopolysaccharides, LPS, stimulated endothelial cells, which was significantly decreased with camphorol. Altogether, the results suggest that camphorol improves barrier integrity, and inhibits the activity of cell adhesion and migration to endothelial cells by inhibiting NF-kappa B expression and TNF-alpha production, thereby promoting its benefits in the treatment of vascular inflammatory disease. The individual effects of these bioactive compounds in honey and their interactions contribute to its overall antihypertensive effects. Conclusions. Honey is a potential agent in reversing metabolic syndrome through its antiobesity, hypoglycaemic, hypolipidaemic, and hypotensive actions. These properties are exerted through the components in honey, like polyphenol, which act as potential lipogenic enzyme inhibitors. Through synergistic actions, these polyphenol can limit weight gain and adipose tissue formation. The antioxidant and anti-inflammatory effects of these polyphenol also prevent endothelial dysfunction and ultimately, hypertension. Honey is shown to improve insulin sensitivity and normalize glucose metabolism despite its carbohydrate content. In conclusion, honey can be used as an adjuvant therapy for prevention of metabolic syndrome in general, by mechanisms such as reducing oxidative stress and inflammation. Thus, it is a beneficial food substance that can be incorporated for the prevention and management of metabolic syndrome. Thank you very much for being on that side. I hope you have enjoyed this content. Don't forget to subscribe to the channel, press the notification bell and give it a like, which helps me and motivates me to create more content.